This is Dr. Saguil with a tutorial on plantar fasciitis. I have a link to a blog that I did about plantar fasciitis, and I'll place it on the bottom of the screen. The objective of this tutorial is to talk about the basic mechanisms of how I take care of the problem. So no matter what caused the issue with the heel, the plantar fascia, which I'm going to use this as a simulation. If this is the bottom of the foot, you'll have a tough ligament that goes from the heel to the five metatarsal heads, the ball of the foot, and that tough ligament is almost like a fan. It inserts into one point on the heel and several points on the base of the toes. But unfortunately, because it kind of gets tugged on, it'll tug at the one single point. Most of the time, plantar fascia works as a ligament, works to keep the arch in the foot. Arches are great for ballistic movement. Unfortunately, some of us are flat-footed, and it does put a little more pull into the arch. When there's any form of damage, whether it's from walking continuously, the new activity, wrong type of shoes, jumping and hitting, it'll cause inflammation to that tendon and ligament junction, and it'll cause persistent pain, especially if it's not taken care of. So again, please refer to the blog for more details, but the bottom line is how do I take care of it? First, we identify the problem, whether it's x-rays or MRI, identify that there's no fracture. If there's no fracture, fantastic. Then it's a matter of stopping any further damage. One of the best things to do is to avoid using the shoes that caused the problem. These are the shoes these are marathon shoes. A lot of runners will get into very low heels with resultant minimal arch. The barefoot runners, it's a new craze now, but unfortunately, because of the low arch, it also, if you're just breaking into this type of shoe, it forces you to run like this. Most people can't run on their toes if they're not used to it. This is a sprinter stance. Most sprinters will run on toes only. If you're not used to running with these shoes, it puts a lot of pull on the heel. So I would say avoid using or breaking in any new shoes. Stick with the old ones that you have. And then also, in addition to causing further damage, the biggest problem with chronicity or persistence of pain is because at night when the foot sits on the bed, it tends to fall into a curved position, and if that ligament is irritated, it's going to want to shrink. Over the course of 8 hours, 6 to 8 hours, it'll shrink, and that's part of the healing process. The only problem is when you take your first step in the morning and splay out the toes, you break anything that was formed as far as the healing bond overnight, and that starts the whole issue of further damage and irritation and pain. So sometimes using a night splint. This is essentially a splint you put your foot into. As you'll see in the picture, night splints are good for keeping the foot at 90 degrees. So if the foot is at 90 degrees, then it won't fall down and curl. The toes won't curl at night, causing a shortening and essentially gluing the ligament into a short position. It keeps the foot straight. Doesn't get too sweaty, but keeps the foot straight so that over the course of 8 hours with no walking, it starts to heal, but it keeps the ligament lengthened so that you don't have a problem with popping the healed scab in the morning. Again, it's a scab on the inside, so it's a theoretical scab. But this helps facilitate or compress the time frame of healing. The other things that also work to compress the time frame of healing would be anti-inflammatories, whether prescription, and there are some good anti-inflammatories that are over the counter. I think the prescription anti-inflammatories, Lodine, Mobic, and Nambumetone, are a little bit better with less side effects on the belly. There's also steroids that can be used. I usually save prednisone or steroids for people who are about to undergo an injection. Putting an injection in the heel definitely helps with decreasing inflammation quick, but it's painful to do it. Hurts going in, it's great going out. It's great as you walk out. So I usually say people hobble in, they get the procedure done, and guess what? I have to go for the most painful spot with the needle to figure out where to put the steroids. But most people walk out pain-free, so that's a great thing. Again, it speeds up healing time, so you still have to work on lengthening. Still have to work on proper diet. Still have to work on using anti-inflammatories. But again, it's a shortcut. Other things are herbal. Most of my patients know that I like to take advantage of herbal, whether it's curcumin and turmeric, or ASU, cosamine, or magnesium. They all help. Sometimes acupuncture in the right spots. You can actually acupuncture and facilitate healing. That would be more energy medicine, but it has helped my athletes get back to their rigorous training, especially before a marathon. And then there's physical therapy. Physical therapy works to lengthen the soleus muscle, the gastroc muscle. So there's a plantar fascia that's tight on the bottom. There's also an Achilles tendon that goes up into the calf. So if the Achilles is super tight, it's going to want to pull. If the plantar fascia is tight, we're going to want to keep it somewhat stretched. Both of those can be helped with physical therapy. Physical therapy will also work on things to stretch out the soleus, sometimes stretching out the plantar fascia. Or they can use modalities like ultrasound, electrophoresis, electricity, low amperage obviously, to help get more blood flow into the heel so it turns around. And again, the idea is to take what normally would be about 6 weeks and compress it down with proper use of medicines and knowledgeable use of herbal supplements, compress it down to a shorter time period.